Thank you, Brendan. That was a really excellent talk. And we're going to completely change tack now to talk about how we can promote your Neuraxial labor analgesia service. So I have to say, this is probably one of the toughest talks that I've ever had the opportunity to present, because it's something which is sort of more non-clinical and where it's a struggle to find good evidence. The other thing I want to mention to you guys is focusing on the word your. Now, you might think initially that this refers to your group, your department, your hospital, which is probably true, but also it's probably worth remembering this applies also to you as an individual, and we'll talk about what I mean by that a little later on. So as I say, for this talk, I found it particularly hard because I don't have a background in PR, media relations, business management, so a lot of the information you're going to hear from me, I have to confess, is somewhat opinion-based, based upon my experience with either social media, talking to people in marketing or PR, and what I've found doing some sort of research for this talk. So I tried to imagine to myself, okay, so if I'm in the audience and I'm listening to me talk, what sort of questions might I ask? So, should I care about promoting my Neuraxial labor analgesia service? If I should care, why should I care? And if I need to care, to whom should I promote the service to? And then lastly, if I'm going to promote a service, how do I do it? I thought these were fairly reasonable questions that hopefully we'll try and address in the course of this talk. Okay, so to start with, should I care? And if I should, why should I care? So when I did a little bit of research for this, I came across this interesting article by M.B.B.S, I think I pronounced his name correctly, who published this article about Marketing 101 for anesthesiologists in Anesthesiology News back in 2015. And in the article, Amir says, perception is reality. You want to be the one to create the reality of your practice. If you don't promote what you do, then someone else will create the perception of what you do. So in other words, no one knows what you do better than you. So if you don't promote what you do yourself, someone else may not do the job that you'd otherwise like. So if that's the case, what types of marketing approaches are there, and who should we market our practice to? So we may think automatically that the clients that we serve are patients, and that's absolutely right. Remember, as anesthesiologists and as anesthesia providers, we are service providers. So our clients include not just patients, but also hospitals, especially if you're in a group where you're trying to renegotiate your practice on a yearly or 2 or 3 year basis. Payers, because obviously you want to make sure you're getting paid for the service you provide, based upon the insurance type, be it government-based, employer-sponsored insurance, or if the patient is paying out of pocket or self-pay. And obviously we need to make sure we're on good, friendly terms with our surgical and especially our obstetrical colleagues, because they're the ones that are bringing the volume. The patients are coming to them, initially at least, they're not coming to us. So obviously there's a lot of interrelationships going on between these 4 different types or 5 different types of persons on the slide. So no one knows marketing better than hospitals, and there are a number of different types of media that certainly hospitals will use to promote the services they provide, which may involve traditional types of media, including TV, radio, print media, so newspapers, and obviously now in this day and age of tech, different types of digital media. So what I thought I'd do, just to give you an example, is show you an advert that Stanford Hospital, the adult hospital, came out with a little while ago promoting their cardiology service. Now, how did they come up with this idea? Well, the marketing expert at Stanford gives us some information about this. And what she says is they did extensive research with consumers. So they did market research to figure out what it is that people are interested in about Stanford to come to Stanford versus anywhere else. And what they found was, or what the research showed, was that people chose to receive care at Stanford based upon the expertise and the experience of its physicians. So therefore, we probably shouldn't be surprised when we see the advert on the right-hand side of a experienced, well-known interventional cardiologist, who's the guy in the middle, imparting in knowledge and information to his junior colleagues. So the focus of attention is the senior physician that you can see in the middle of the image, with the verbiage underneath saying, when open heart surgery isn't an option, we can implant the new heart valve through a small incision in your leg. suggesting that if you're a high-risk patient or if you're a complicated patient, don't worry, we've got state-of-the-art techniques that we can use to ensure we can do your heart valve replacement. So it's showing that Stanford is like at the cutting edge of technology, and you're going to get that from the best of the best. So what about for OB? Well, if you look at the Stanford website or the Children's Hospital website for obstetrics, they've completely flipped their approach. So this is on the home page for the pregnancy services. So it's very different from what you saw on the last slide. Here, the focus of attention is the patient. So look at the image, she's front and center, you've got a physician probably to the left, and I'm presuming that you've got the dad or the partner of the mother to the right-hand side. You don't even see their faces. All of your focus of attention is on the mother who's looking very happy and smiling with her experience at Stanford, which is cool. What about the verbiage? Well, it's all about you, the patient. It's your pregnancy, it's your delivery, we want to give you that ideal experience, and we're committed to making sure that we're going to personalize that experience for you. So it's a very different style that the hospital is using for obstetrical patients than they did for their non-obstetric adult patients with cardiovascular disease. So are there any general rules of thumb that industry uses when it comes to marketing? So there are, and remember this comes from industry, not necessarily those related to healthcare marketing, but some of these rules probably apply to a certain degree. So what they suggest to start with is identify the needs of the clients or the customers that you're hoping to gain attention from. Develop products to meet those needs and communicate continuously with the customer. So it's not just a matter of creating information that you can then transmit, because transmission is a one-way process. Communication is a two-way process. So you can come out with a website, an app, a blog, and we'll discuss some of these later on. But the patient will receive that information, but you're not communicating in person or interacting with the patient. You have to think about approaches to do that, to get an idea about what they think and feel about what it is that you're promoting. And the last piece of advice from industry is make yourself indispensable. Now that might be a tough one for us because we're all busy providers, working really hard every week and every day. So making ourselves more indispensable than what we really do might be a tough one compared to, say, if you're a young, hip CEO of a tech startup where you're going to be sweating 24 hours a day to make sure that your company succeeds. All right, so let's try and address ways in which we can promote what we do to the hospitals and especially the hospital administrators. So this might be an image that hospital administrators think about what we do. We're proceduralists, right? We are technicians where we provide epidural, analgesia, we provide neuraxial anesthesia for patients who undergo cesarean section. But as we all know, we do a lot more than just put in blocks. And here you've got some examples of some of the work that we do beyond just the procedural aspects. We're involved in committees. We make policy. We lay down recommendations. If you're in academic places, you may well do research. You may become an expert in a niche area. You may be involved in teaching juniors, nurses, MDs, students, and some of the teaching techniques that you use may be state-of-the-art in the form of simulation. You may be involved in setting guidelines for your hospital, working with obstetricians and experts in patient safety to optimize care on your labor and delivery unit, being involved in morbidity and mortality reviews, patient blood management, and even just think about what you do on a daily basis. You're involved in helping to schedule and even triage patients that the OB may not be able to help out initially, especially if they're tied up in the OR. So for example, let's imagine the OB's in the OR doing a C-section and one of their patients is on the labor and delivery unit with increasingly high blood pressure. You're not going to sit and wait for the OB to come out of the operating room. You're going to go in and you're going to try and make sure that that blood pressure is better controlled. So we are becoming peripartum medical experts and physicians as well as being anesthesia providers. So that message really needs to be communicated well to hospital administrators, in addition to the fact that we communicate well, we're great facilitators, and also we're great leaders. So we're natural-born experts when it comes to being leaders in the field. The other thing to bear in mind is that the platform in terms of reimbursement is changing. We're going from fee-for-service to getting reimbursed based upon the quality of care and the value of care that we provide. And it's worth noting that certainly in terms of Medicare patients, which probably may not be applicable to OB, but certainly it's going to have a ripple effect is that the government is expecting, in terms of payment, quality for the type of service that we provide. And it's happening right now because of changes in the healthcare law, where we've moved from the sustainable growth rate formula to MACRA. MACRA is a Medicare Access Chip Reauthorization Act that came in 2015, whereby we're going to have to work hard to prove to the government that we are providing good quality care. And I'd imagine, as we mentioned earlier, that this is going to have a ripple effect in OB as well. They want to look at measures that we are using to prove that outcomes are good or the quality of care is good. Some of these will involve, certainly from an anesthesia standpoint, making sure documentation is good, avoiding hypothermia, ensuring there's a checklist that's in place for PACU transfer, and doing our best to prevent nausea and vomiting. So we're doing these things already, but they want to see evidence that we're doing a good job when it comes to assessing and monitoring and preventing some of these morbidities. Hospitals want accountability as well for this, to ensure that we're optimizing safety and outcomes, improving efficiency depending on how many C-sections you're doing on a daily basis, and making sure that patients are happy with the quality of service and experience that they're getting as well, which may be based upon Press-Ganey scores. And lastly, we have to make sure that we're continuing to innovate using appropriate technologies, be it through the form of an EHR, electronic health record, which you can use to track your quality outcomes, and also using appropriate technology to optimize the type of care you're providing on your labor and delivery unit. So let's take an example of this. So one example is we've made a lot of progress in terms of how we deliver pain relief in labor, which I'm not going to talk about, but I'm only going to mention this in terms of how we innovate. So we've moved from using continuous infusions with PCA to programmed intermittent epidural boluses with PCA. Now there's evidence to show that there are improvements, even if they're modest, in terms of satisfaction, a reduction in local anesthetic consumption, and even the possibility that patients are spending a reduced amount of time during their labor experience, so a reduced period of time during the second stage of labor. Now, even though some of these benefits, some may argue, are modest, if you think about a large cohort of patients that delivers over a quarter or a year, that impact on your labor and delivery unit is going to be much greater than it might be for an individual patient that spends less than 12 minutes or 12 minutes less during the second stage than someone that has a continuous infusion. So that may mean for 5 or 6 patients that you've got now more space available in your labor and delivery unit if you're using PIB versus if you're using continuous infusion with PCA. Now that's going to get more interest from your administrators as well as your colleagues, knowing that satisfaction is better if you're using these techniques versus, say, an infusion with PCEA. All right, so let's talk about patients, and let's find out what patients want to hear. So certainly when we think about patients, they're obviously interested in knowing where they're going to deliver. So there are various factors that will influence the decision in terms of where they will choose to deliver their baby. It's very likely that one of the main factors is based upon the type of insurance they have, because obviously depending upon the insurance, that will determine or designate the type of hospitals that they can choose to deliver in. I would imagine that in most cases they'll try and choose to deliver in a place that's not too far from where they live. But there may be other factors that they'll think about as well. So much will depend maybe on whether they're low risk or high risk, whether they're interested in a natural childbirth-like experience, even if they deliver in a hospital, what the staffing is like. So in other words, who's going to deliver my baby? Do they have a midwifery-led service, or will there be an MD who's delivering my baby? There may be other hospital factors as well. So, what's the room like? Will I get a private room? Will the food be good? Can my spouse and my family hang out, and is there space available for them? So these things probably influence some of their decision as well. So let's look at some of the hospital factors that may influence where they may choose to deliver. And there's more and more information available to the public about what the hospital provides. So in California, if you look up hospitals on Yelp, you can get a lot of information about the hospital in addition to where the location is and what patient reviews are like. And this information is coming from the California Department of Public Health, where they're now having this relationship with Yelp, so you can see how the C-section rate compares to the national average, what the rates of breastfeeding are compared to the average, what the episiotomy rates are, and if they offer a VBAC service, and if they do, how their VBAC service or rate compares to the average. Now you can see here that the classifiers for these are whether you're at average, below, or above. So that's a little crude. But you can actually get more detailed information if you go onto this Cal Hospital Compare website. So what I did here is took 2 hospitals in California, and we've done some side-by-side analyses. On the left, you got M.B.B.S, which is a hospital in the East Bay near Berkeley, and you got Palo Verde Hospital. By the way, I hope no one comes from other of these hospitals, who are based way down in Southern California. So let's see how they compare. So M.B.B.S, they've got a C-section rate that's below average. They've got a breastfeeding rate that's above average. Their episiotomy rate's pretty low, and they do offer VBAC, and their VBAC rate is higher than the state average. By the way, this is crude, these are not adjusted rates. Whereas in Palo Verde, and I don't know much about the hospital down there, but their C-section rate is slightly above average. They don't get a rating for breastfeeding. Their episiotomy rate's a little higher than average, and they don't offer a VBAC service. So at least there's some information you can get about the hospital. Whether or not influences patients' decisions or not, I don't know, but at least the information is out there. So what about where patients get information from even before they deliver about pregnancy and childbirth? So this is an area we probably know somewhat less information about. We've got some information from this survey, which is a survey of a nationally representative sample of women. And what they did is, as part of the surveys, they asked them where the information was about pregnancy and childbirth, which they found to be most valuable. So not surprisingly, the highest ratings were from the maternity care providers. And we really shouldn't be surprised, because that's the closest relationship that patients have during the course of pregnancy before they arrive at the labor and delivery unit. After the maternity care provider, the next most common place, or the place where they found the information next most valuable, was from a childbirth education class. So that is one area where perhaps we can get involved, where you can maybe be able to think about giving a lecture about pain relief and labor, along with your OB colleagues and pediatricians that may talk about maternal and pediatric stuff. So after that, then we see tech getting involved. So patients are looking for information on pregnancy and childbirth websites. They're looking at apps, and then further down, information maybe from health plans, from the government or the state, or from their employer. Okay. So what do we know about what patients know about neuraxial labor analgesia or any other aspects of OB anesthesia? Well, TV doesn't really do us any favors, right? There are a lot of medical dramas that have been and continue to be produced for TV, but I don't know of any show that has an anesthesia provider as a lead actor or actress, nor do I know of a show that has someone who's an OB anesthesia provider as a lead actor or a key actor or actress on the show. So we're not really getting a lot of exposure on TV. Well, what do the public know about what we do? Well, this is where it gets a little harder to figure out. This is a survey that was carried out in Israel, where they took a sample of the general public and asked them about what they knew about anesthesia providers and where they work. And the arrow here indicates that only 60% of the public that was surveyed in Israel realized that we were even involved in the labor experience and worked in or close to a delivery room. This is Israel. We don't have any data from the US. What about where patients get information from about labor analgesia? So again, the information here is fairly limited. This is an article that our colleagues in Northwestern published, which was basically a qualitative survey in a fairly small cohort of women, so only 45 women. But at least here we get some idea. So it looked like most of these women got information from their OB. So again, we're not surprised. We talked about this a little earlier. They have an established relationship with their OB. They trust their OB because they're seeing them on a regular basis throughout the course of the antenatal period. They don't really see us, unless maybe there's a specific problem, until they arrive on the labor and delivery unit. So that in-person relationship is not established earlier on like it is between the patient and their obstetrician. Nearly half of the patients will get information from the internet, so that's one area where we can think about interceding. And nearly 3/4 of the women preferred counseling from their OB during the second or third trimester about labor analgesia. So what does this tell us? This basically tells us that we need to liaise and work with our obstetricians to ensure that the information that the OB is providing the patient is accurate, and we need to think about ways that we can transmit that information with help from the OB when they see them in the clinic during the second and the third trimester. What about information on hospital websites? So there is a study again that came out from the Northwestern group where they reviewed information, if it was available, on teaching hospital websites about neuraxial labor analgesia. So amongst the cohort that they looked at, they found that just under 60% of teaching hospitals actually had any online information, and of those that did, about 15% made the information understandable at a grade level that was less than 6th grade. So you might think 6th grade, it's pretty low, but unfortunately many of the public don't have an understanding or an English linguistic ability to understand English beyond that level of grade. So you really have to break it down in very simplistic terms. But the question I really want to know is a teaching hospital website a likely place where patients will look for information about labor analgesia? And I don't know whether it is unless they're being directed to go there, perhaps by their OB or through other means. They're probably going to look for information from other sites. So if that's the case, what are these other websites providing in terms of the information about labor analgesia, be it neuraxial or non-neuraxial? And this is where it gets a little more concerning. There is a lot of information that's out there which is not especially accurate. So let's take, for example, the American Pregnancy website, the American Pregnancy Association website, where it's a big deal website. If you look up pregnancy, Google it, this organization will probably come up fairly top or close to the top of the list. So they have a web page about pain relief and labor, and this is the image that accompanies the web page. So this is nothing, it's not showing you a patient receiving an epidural. They're getting an injection with like a 3 cc syringe. It's probably got some local in it, but who knows? So it's not an accurate reflection. It doesn't actually accurately reflect the important procedural elements of someone who's receiving an epidural. And then the lay media, unfortunately, doesn't do us any favors, sometimes coming out with headlines like this, where they're saying a botched epidural may be making women terrified of giving birth, albeit this was a little while ago. And this is from a midwifery website, again a little while ago, with the headline saying, epidural anesthesia leads to more cesarean sections. So that means that we have to now combat the misinformation that's out there from these websites in order to ensure that patients are getting factually correct information about pain relief options in labor. Now, despite the type of misinformation that's available out there, how commonly used is neuraxial labor analgesia in the US? So we looked at information from the from birth certificates from women who delivered in 2015, and actually rates of neuraxial labor analgesia are pretty high in the US. So about 70% of women who delivered in 2015 use a neuraxial labor analgesic. So that's great, right? We know that there's a high uptake for the services that we provide, and therefore there must be interest in the use of an epidural or a spinal anesthetic for labor pain relief. So therefore, how should we try and promote what we do to the public? So let's start with some easy first steps first. We can think about having a stronger local presence. So depending on where you work, if you're not already doing it, then think about childbirth classes or parents' evenings where you can have a presence, work with your OB and your pediatric friends to show off about the type of work that you do on your labor and delivery unit. Perhaps your hospital provides community lectures to the public about the types of work that your hospital provides. So reach out to whoever's involved in the marketing department for these lectures and see if you can get involved. Talk to local women's groups if they're out there and see if they can get interest about what it is that you're doing, and then reach out to local TV and local newspapers. Presumably they have health correspondents that may well be interested in the type of work that you do on your labor and delivery unit. So it means being fairly proactive, using these old school type of approaches. But as we all know, this is a new era in terms of tech, and a lot of the marketing is happening online, which involves social media, especially in this area for those that work in the Bay Area. So are there any recommendations in terms of approaches that we can think about for healthcare marketing that we could apply to our labor analgesia service? So this is an excellent article that came out from Marie Ennis O'Connor, who's a health marketing expert on a healthcare blog that she's published. And she's devised 10 sort of winning steps to optimize your strategy from a marketing standpoint. So our first step is define your purpose. What does that mean? It basically means what it is it that you want to do? Do you want to just brand yourself? Do you want to try and educate patients and be a good Samaritan? Do you want to promote the work you do to improve volume and therefore improve your revenue? So depending upon what it is that you want to do, then you're going to identify what your audience needs are. So go out there and do the market research to figure out what it is that patients want to know. Once you've got that information, then that will help you define your content format. So do I need to use social media? Do I need to develop a website? Do I need to develop some form of blog, be it a written blog or a vlog? You know what a vlog is? It's a video log. And videos are pretty cool and very trendy now in the marketing industry. You have to make sure that once you've developed the content, you keep it flowing and keep it up to date. Captivating headlines really help as well. So asking a question like, how does an epidural help me during labor? Why might an epidural improve the quality of my labor experience? It's all about creating positive spin. Adding images are really important as well, as you saw earlier on from the Stanford advertising approach. And adding a call to action may be helpful as well. So you can create your content, and at the bottom you can have a box that patients click that may take them to your website that they may not otherwise find unless they went through a social media or another form of marketing approach. Hashtags and keywords are really important as well, so you need to sort of figure out the type of words and the type of hashtags that patients are using, and I'll show you an example of that very shortly. And then promoting your content is really important. So then this involves advertising, right? So you may have to think about spending some money if you feel that that's important, that may influence the type of work that you do and the type of revenue you can get back, be it through Google ads or social media ads that you can buy on Instagram, Twitter, Facebook, and so on. And then last but by no means least, what you want to do is find out, once you've got all the information, you're putting it out there, are patients actually looking at it? And if so, how often, and what type of responses are you getting? And there's various types of software and websites that may be able to help you from an analytics standpoint for that. So I mentioned hashtags and words and terms to get people interested. So here's an example, which I thought was quite a cute example. You probably know what Charmin is, right? Charmin's toilet paper. So Charmin had a very interesting approach for their most recent marketing campaign. It's a pretty tough gig to market toilet paper to the general public. So you want to try and make it maybe use a cute approach to try and get people interested. So their hashtag was enjoy the go, with their slogan being sit back, relax, and enjoy the go. So they made it very cute and rather tongue-in-cheek, and they've got a cuddly bear there, and they're using nice pastel colors. So their approach to marketing is they're not focusing on the actual literal aspects of what you're doing with their product. They're making you think very differently from a psychological standpoint about the benefits of using their product. So social media. So obviously we're all using it, I hope. In fact, just out of curiosity, who has a Facebook account? Hands up who's got a Facebook account. So a fair number of you. Anyone, hands up who's got a Twitter account? Oh, a few less, okay. And anyone else use, say, Instagram? Oh, okay, so it's happening. It's out there. So obviously, a lot of people from, in terms of healthcare and in terms of medical societies are using Facebook and these social media sites to promote the work that they do. So SOAP, for example, has a Facebook page. It's also got a Twitter page. But going back to what you mentioned right at the beginning, you can also establish your own profiles online from a professional standpoint. So, for example, I set up an OB anesthesia Facebook page, and the URL for this at the bottom of the slide. The purpose of this was to be a good Samaritan to promote the work and the research that's being done within the world of OB anesthesia. Anyone can access it. You can use your Twitter page to connect with other people on Twitter to keep up to date with the literature and find out what the latest advances are in the world of OB anesthesia. So you could be what they call a micro-influencer, and there's a few of us out there that do this. If you don't already, you can establish a LinkedIn profile. This is basically an online way of putting your resume and CV out there for the world, and you can then use this to see whether there's any opportunities out there for career progression or career development. If you do research, you can establish a profile on ResearchGate and see what all your other research buddies are up to. And then if you're an MD, you can use Doximity, which is basically a social media website for you as an MD to connect with other MDs. And Doximity is the main one, and Somo is also a very popular one. And then if you want to get an idea about who's following you or what people are tracking, the type of progress that you're making, there's ways to do that through Feedly, Google Alerts, and even if you have the money and you have the revenue, you can subscribe to Monitor or Mention to figure out who's using and who's tracking your progress online. And then keep up to date with the latest advances in marketing. As we mentioned earlier on, video is really, really important now from an industry standpoint. They're using, because millennials have a very short attention span, like they're saying something like an 8-second video is enough to keep people interested, in anything beyond that, and they're lost. So you can use video on various different social media outlets, such as Snapchat, Instagram, Twitter, and so on. Okay, so to wrap up, as we all know, it's a really tough marketplace out there. There is an incredible amount of competition for patients to have their medical care at various hospitals, and we see this on a regular basis if you just look at the billboards on 101. So stay up to date, continue to innovate, and think about new and old school approaches to market yourself and your group and your department in order to ensure that patients are kept happy from an education standpoint and maybe even improve your revenue as well. So I'd like to thank you for your attention and look forward to the panel where we can hopefully answer more questions, and feel free to tweet me, Facebook me, or email me. Thank you very much.